While you were voting, coronavirus resurges just as many feared it would. Michigan sees its highest daily case counts yet. The governor says we are overwhelmed as hospitals and schools try to adjust on the fly. Today is Sunday, November 15th, 2020, and this is Flashpoint. Hi, welcome to Flashpoint on this 15th day of November, which means Thanksgiving is now less than 2 weeks away. Just about every American family has its Thanksgiving rituals, but few cities are as laden with Thanksgiving tradition as Detroit. America's Thanksgiving parade, the annual game for the Lions, they're piled on top of the full table and family get-togethers. But as Governor Whitmer noted Thursday, Thanksgiving will look different this year because it has to. The parade will be a strictly televised event. The Lions will take on the Houston Texans at a nearly empty Ford Field. And health and government leaders are urging us all to set smaller tables this year. Connect with family via FaceTime and Zoom rather than in person, lest we allow yet another gathering holiday become a super spreader moment. And looking at the daily totals, the testing positivity rate, the surging occupancy rates at hospitals, we have very little margin for the numbers to get even worse, and yet almost everyone fears they will. We're going to set aside the political world this morning and focus on the virus that is now killing many more than 1,000 people a day right now in the U.S. Yes, we were given a dose of hope last week for the arrival of a vaccine, but it will not come in time for too many. And as we fight COVID fatigue, public health experts are trying to slap us awake and get us back to all of those extra measures that we were taking in the spring. It means another boomerang for schools. Parents who in some cases just got a few days of in-person learning are suddenly back home. And the state's biggest district, the DPSCD, has parents scrambling to make arrangements to go back to remote learning starting tomorrow. We're going to talk about the school dilemma just ahead. But let's begin with a rather extraordinary Zoom news conference that happened on Thursday when we saw the leaders of most of our area health systems all together urging us to steer around the disaster taking shape on the horizon. We'll start there today on Flashpoint. Well, it was a most unusual scene this past Wednesday. We saw a Zoom screen full of faces and voices that are usually competing with each other, but this time all coming together to try and get Michiganders on the same page when it comes to fighting coronavirus. Very good to have with me two of those faces and voices. Brian Peters is with us, the CEO of the Michigan Hospital Association, which represents all the community hospitals in Michigan, and Wright Lassiter on the right, Wright Lassiter III, the president and CEO of the Henry Ford Health System. Brian, let me start with you. If it doesn't speak for itself, tell me about the moment at which we've arrived when it's necessary for all of these hospital CEOs and administrators to come together and try to get us on the same page.
Well, thank you so much for having us. And you're exactly correct. The end goal here is to get everyone on the same page. And certainly that starts with our hospitals. As you said, perhaps competitors in the marketplace, but when you're facing what is truly a public health crisis, and that's what we are in today. We really do need to come together, and that's exactly what's happening. And our member hospitals and health systems yesterday wanted to speak with a united voice and make very clear to all Michiganders that this is a pandemic to be taken very seriously. It's a pandemic that is affecting not only Southeast Michigan, but quite literally the entire state. So we are calling on all Michiganders to do their part and help us to defeat the COVID-19 pandemic.
Brian, was there a metric that we ticked over? Was there something that you saw, or has this been bubbling for a while as an idea to get everybody together to speak with one voice?
We had been very hopeful over the summer months that we had been successful in flattening the curve, and there was always in the back of our mind a concern that we would see a second wave. And in fact, that is precisely what has transpired. And as we look every single day at a number of metrics, positivity rates, a number of Michiganders who are testing positive, but in our case, looking very specifically at the number of hospitalizations, we are on pace, if the current trends continue, to surpass our all-time record high that we achieved earlier in the year in terms of inpatient hospitalizations, COVID-related, within the next several weeks. And so it is certainly time to ring the alarm bell.
Right, Lassiter, how is this different, do you suppose, from, I think everybody felt like we got over the roughest patch, which was back in the spring. Is what we're seeing right now different, or is it more like hitting the repeat button?
Devin, thanks for having me, and I'm really pleased to be here with Brian to talk about our efforts to fight the pandemic. To your question, I would say the answer is yes and no. It's the same in that we have a significant escalation of morbidity and mortality in our state. Individuals who are testing positive, individuals who are needing to be hospitalized, and individuals who are dying on a daily basis. And so, to that regard, it's very similar. What's different today is the distribution of cases. Southeast Michigan was primarily hit hard and early back in March and April and May. And so, it really was the Southeast Michigan hospitals that were bearing the significant brunt of the coronavirus hospitalization challenges. Today, you're seeing it spread across the state. You're seeing escalation of cases and positivity rates in Grand Rapids, in Lansing, in Kalamazoo, in the Upper Peninsula. And so that's different. And for us, I would tell you that it's quite different. Certainly the volume at this moment is not what it was back at the height of the pandemic in the spring. During our highest period of time, which occurred in April of earlier this year, we had just under 1,000 patients across all of our hospitals. Today, that number is in the low 300s, and so we certainly don't have the volume that we had back then. But what's different is that our leading hospital with inpatient cases is Macomb, Henry Ford Macomb. Last time, clearly the case volume was the highest and the hospitalization was the highest in the city of Detroit.
Right.
And so Henry Ford Hospital bore the brunt, even though every facility of ours had cases. But it's interesting today that it is Macomb with well over 100 inpatient cases, Henry Ford Hospital with a bit over 60 cases. And then we see almost the same number at our Henry Ford Allegiance Hospital in Jackson, along with a similar volume at West Bloomfield and downriver. And so we're seeing a spread across the entirety of our system, but with a concentration in places that we didn't see last time. And I guess I'd say lastly, the other difference is we know that throughout the summer, what was a significant benefit to the hospital systems were that as the cases were rising, they were rising with younger individuals who were not having the same level of morbidity, of symptoms, as was the case early on with folks in their 60s and 70s and 80s contracting the disease. We're now starting to see that shift change again away from the under 30 population back to the 30 to 39, 40 to 49, 50 and above. And those are the individuals who oftentimes have underlying conditions and will have a greater need for hospitalization and work from the healthcare industry.
In fact, right, the lowering mortality rate, which hard to say that that's not good news. It has been a little bit less deadly over these last couple of months, but that's also kind of hurt your cause a little bit, right? Hasn't it maybe created a little bit of a false sense that we've got this under control, that it's not as bad as we thought it was?
Yeah, I absolutely believe that we're dealing with a bit of early optimism that was premature because we all want to get back to some sense of normal. And so certainly as the cases were going down in the summer, it was a combination of people being outside and frankly being able to be in places where they could social distance, even if they weren't wearing masks, even though we know that many were. So I do think it's a bit of premature optimism. I also believe it's pandemic fatigue. We've been going through this for a long time, and as human beings, we oftentimes we want a bit of instantaneous gratification, right? We want to be rewarded for our efforts, and so I think that's a part of it. And then I would also say that because there were parts of the state that you didn't see cases previously, I think a lot of folks put their guards down and said, "Oh yeah, this isn't really happening in my community," and so they felt less inclined to do what's necessary. And I would honestly just say, Devin, that that's what we see across the country. When you look at the states in America today that have the highest rates of case escalation, it's many of our states that have some of the lower populations. It's places like North and South Dakota, where you don't have large urban centers. And so it's clear that the pandemic not only strikes in urban settings, but it strikes in rural settings and suburban settings and settings where there's humanity.
And a lot of those places we're seeing positivity test rates that are into the 40 and 50%, which is hard to even imagine. Brian, let me get back to you. We saw back in the spring Governor Whitmer and other local health officials making plans to create sort of satellite hospitals. We knew there was going to be the situation at TCF and at the Suburban Collection. And on closer inspection, they didn't get used very much because we find that they're really not set up to be hospitals. You can't be, 100 yards from a bathroom if you're trying to set up a hospital. What happens now as we've learned more if our hospitals get pushed to the breaking point? What do we do this time?
Well, when you look at healthcare, nothing's easy. But in relative terms, it is easier to add beds, add capacity to a hospital or a facility. The thing that is much more difficult, and that applies to a traditional hospital or to a field hospital, as you alluded to, is the staffing element.
Yeah.
And so unless those alternate care facilities or field hospitals come with new staff complements, they aren't truly going to help us much. I think we are wide open to any and all innovative solutions, including alternate care facilities, as you described, if in fact we reach our capacity point within the traditional hospital structure. But I think, as Wright would tell you, it's really that issue of having enough frontline caregivers, particularly when many of those frontline caregivers in our hospitals are also testing positive for COVID, mainly catching that because of community spread, catching that in small group settings in the community as opposed to in the hospital. But regardless, the staffing issue is really going to be the most complex and complicating.
In fact, that's what's led to this situation in North Dakota, where you've got COVID positive healthcare workers being told they can go ahead and work to take all the best precautions that they can, but such is the plight of having enough hands on deck. Right, I'd love to let you weigh in on one issue that seems to continue to linger. President Trump had made a claim of this during the campaign stretch, and I still see it on social media and in emails, and that is that COVID cases are somehow profitable for you and for doctors treating them, and that it's in your best interest to have more of them.
Yeah, I would just say that unfortunately that's not factual when you look at the totality of what we're dealing with. It is certainly true that there is a small uplift around COVID as it relates to the increased cost of providing care for a COVID patient. And so while that is certainly true, but when you think about Medicare reimbursement for providing care, generally speaking, Medicare reimbursement, which is what comes from the government, does not fully cover the cost of care for the vast majority of healthcare systems across the nation. And so it's certainly not a truism that the hospital industry or physicians as a profession have any incentive to code someone as a COVID patient to make more money. That's just not true.
Wright Lassiter, Brian Peters, thank you both so much for your time today. I know you both are fearing what might be on your plate here over these next couple of weeks. We wish you and all of your colleagues all the best. Thanks for the time.
Thank you.
You bet. We'll continue with more on Flashpoint as we move now. What do schools do as the pandemic worsens? This is Flashpoint on Local 4.
This year, more than any other, are you certain you have the right Medicare plan? HAP is here, helping our neighbors navigate Medicare. Offering Medicare plans with $0 monthly premiums, $0 primary care, and $0 on most preventative vaccines. Collaborating with doctors and hospitals to create plans for today's world, with more bang for your buck. Up to $400 annually for things like over-the-counter medicines or a blood pressure cuff, dental, vision, and hearing coverage. A travel benefit so you can travel the U.S. with in-network coverage and 24/7 telehealth. Looking for more value? HAP is here. Talk to one of our Medicare specialists to set up a no-cost, personalized consultation and request your free HAP Medicare planning guide. Face the future with confidence. See how HAP is here for you.
The good news is the flu shot is in plentiful supply this year. I wanted to be sure to get mine.
This year, more than ever, it's really important to get the flu vaccine. We definitely do not want to see a flu epidemic on top of a COVID pandemic.
It takes 2 weeks for the vaccine to be effective, so you'll want to get it before flu season starts in earnest.
CDC recommends everyone over the age of 6 months should get the flu vaccine.
Connect with your St. Joe's primary care physician and get your flu shot today.
Welcome back. When Governor Whitmer said this past week we are being overwhelmed by the coronavirus, she wasn't talking specifically about the schools of Michigan, but you can imagine the overwhelming decisions having to be made again by superintendents all over the state. And joining me now, superintendents from 2 districts going to all virtual learning. From the Troy district, there on the left, Dr. Richard Mashesky, and on the right, Dr. Nikolai Vitti of the Detroit Public Schools Community District. And they just made their announcement this past week and heading back starting tomorrow, which is Monday. And Dr. Vitti, let me start with you. This has to be a sort of a painful moment to come to, for both of you. But tell me a little bit about at what point you realized that you got no choice.
Yeah, it was a painful decision to make. Obviously, you would have to be living under a rock not to know that myself, the school board, and the district from the summer was advocating for in-person learning because we knew just the unique needs of our parents necessitated an in-person option. We were never interested in imposing an in-person learning option for our children, but that our parents and students would at least have the option. And 10,000 students took that option, whether it was face-to-face learning or our learning centers that we ran in all of our buildings, over 100 of them over the last 2 months. But, you know, we said we were going to use science and data to determine if it was safe for schools to open. And consistent with that, we said we would use the same criterion to decide if they needed to be closed. And last week, the city announced that its infection rate was at about 4.8%. That was the latter part of last week. And every day as I monitored the numbers, they were increasing. And I know today is usually the day that the data is announced for the week. I anticipated it being at 6% or higher. We said anywhere from 5 to 7% would be our trigger to have a conversation if it was safe enough. And with it at being anywhere from 5 or 6% in the city, we just feel like right now it's too unsafe to continue with in-person learning. And we announced the suspension of in-person learning effective today. We're going to leave the learning centers open on Monday as a courtesy for parents that couldn't readjust their an educational time for parents over the weekend. But we feel like this is the right thing to do. And with everyone moving into the holidays and interaction probably increasing, there's no sign here that the numbers are going to go down. We still don't have a national COVID safety strategy. And with the legislature and the Supreme Court at the state level stripping the governor of her executive orders, I just don't see how these numbers turn to being more positive, and that's why we made the decision that we made.
And you've said that that will be until at least January 11th, looking into the next year. Dr. Mashesky, tell me a little bit about the calculus that you made in Troy. I've got a friend who's got high schoolers. I think she got all of 2 days of in-person learning before they were headed back home. Tell me a little bit about the way that you've made the decision and your outlook.
Yeah, we had decided to start transitioning our students back in at the end of September. Felt really good about where we were, but to Dr. Vitti's point, as we saw those numbers continuing to rise, we were watching them very, very carefully. 2 things really came to mind for us: the increased number of cases within our buildings amongst students and staff. Because those numbers continue to rise, we were quarantining students and staff alike. And at the county level, when the Department of Health and Human Services pushed Oakland County to a risk level E, which is the highest risk level. With increased cases, that risk level E, we didn't see any scenario wherein it made sense in terms of safety for both staff, students, and all of our support staff as well, and our entire community, where we could keep students and remaining in in-seat instruction. So at that time, beginning this current Monday, we dialed back to virtual instruction.
I want to let you both weigh in on something that you may not be able to answer yet. We may be too close to this, but are you convinced that even learning at home, that our kids are being well served, or is there just no getting around the fact that this is a poor substitute for the way that our kids and our systems are built? Dr. Machewski, let me start with you. Can we get kids the same quality education when they can't be in the building?
Well, there is no substitute for face-to-face instruction with a highly qualified teacher and students in the classroom. I don't believe virtual instruction is a suitable alternative. It is the best that we have at this point in time, and we're making the best of it, just like our counterparts are across Michigan. We're doing the absolute best we can to meet the needs of students. But at the end of the day, we recognize it's important for both socially, emotionally, as well as in terms of achievement for students to have them face-to-face with their teachers. Students are by nature, schools are by nature social places, and they're places where kids thrive, and they're places where our teachers do their very best work. So we need to continue to do everything we can to get them back face-to-face as quickly as possible.
Dr. Beatty, I assume you agree with what you've just heard. Is there anything we can do to try and keep this from being a disaster in the long term?
Yeah, I would agree. I wouldn't say anything differently. I would say that, yeah, certainly there's a small number of students that I think probably prefer online learning to face-to-face, and a small group of teachers that prefer it, but certainly not the majority. And I don't think any educator would say that online learning is superior to face-to-face instruction. But for some, I think it's an educational process that makes more sense for them based on their learning needs, but certainly not at scale. I'm just hopeful that our numbers can come down at least by around that 5% level and stay there, so we can reopen our learning centers. We won't open up in-person learning again until after January 11th, and our numbers would have to go below 5% and stay there. But at least I would like to open up the learning centers again, because for a lot of our parents that are managing jobs during the day, lack of childcare, it's really hard to support their children at home, but the numbers are just too high to do that right now.
And Dr. Machewski, you too, talk a little bit about the burden this is putting on parents.
Oh yeah, without question. I'm fortunate to be the father of four. They're older. I can't imagine what our parents are going through, having to supervise their students through their learning, as well as, and in many cases, do their own work. And so we feel deeply for our parents and want to do everything we can to continue to provide support for them. And so in Troy, we're providing opportunities for emergent child care for our families, those that want to take advantage of it. But it goes back to, as a community, we need to come together and do everything we can to draw these numbers down so that we can get our kids back in school. It's better for our students, and ultimately it's better for our parents and our families in general.
Dr. Beatty, I've only got about 30 seconds left, but I wanted to let you talk about whether or not, what kind of trouble you might expect or unrest. You had kind of a rocky summer with, we saw some protesting, we saw some hassle around some of the buses. What are you expecting the reaction to be this time?
Well, after opening up schools for in-person learning in the fall, our employees did a wonderful job of containing the virus, where we only had 3 outbreaks, and that's outstanding compared to what happened throughout the state. And when I made the difficult announcement of suspending in-person learning just now, I heard from quite a few parents that said they didn't love the decision, but they understood it. And I think we've come a long way as a district for our parents to trust the difficult decisions that we have to make, and that we're making decisions based on the safety of our children and our employees. And I think the decision to open and now the decision to suspend And the reaction is a testament of building that trust.
I don't envy either of you the decisions you're having to make. Dr. Vitek, Dr. Mashesky, thank you both so much for the time today. Good luck the rest of the way. We'll talk to you again soon.
Thank you, Devin.
Thank you.
We'll wrap things up on Flashpoint right after this.
Forgotten Harvest does make all the difference for me. It really, truly does.
Most people are on a limited income.
Gave us food that probably wouldn't been able to buy.
They have whatever it takes to feed a family.
Forgotten Harvest means the difference between having a full meal or just a box on the table. When things happen in life, Forgotten Harvest is there to help you.
In the face of COVID-19, staying healthy is important. And now the same is true in the face of flu. Influenza has the power to infect millions, putting lives and the healthcare system at risk. Fortunately, it's easy to protect yourself. The flu vaccine is safe and effective, and with COVID-19 still spreading, it's essential. To see how you can hit this virus head on, visit michigan.gov/flu.
We are all out of time. Thanks so much for being with us. Meet the Press coming your way next. Have a great week. Stay safe. We'll see you next time on Flashpoint.